Before electronic health records, before 10-minute appointments, before the pandemic reshaped how care is delivered, patients could be passive participants in their care. They could show up to a medical appointment, describe their symptoms, and trust the system to take it from there. But that system no longer exists. In today's healthcare environment, people are expected to manage more on their own. Records are fragmented, visits are brief, treatment plans are more complex. The burden of clarity now sits with the patient, not because providers want it that way, but because the structure of modern care makes it necessary. Historically, we've addressed patient engagement with tools like surveys, reminders, and upgraded patient portals. For a time, that worked. These tools made sense in an earlier version of care when systems were less complex and expectations were lower. But as the electronic health record became more central and more layered, those same tools started falling short. Patients began relying on the system to manage their care for them, and that passive relationship started breaking down. Now CMS is asking for more. They want to see real patient comprehension, active participation, and measurable behavior change. Engagement can no longer be surface level or limited to what happens in the treatment room. At Patient Better, we meet this need by teaching people how to participate in their care from the comfort of home before they even step into your practice. This isn't another portal or just another survey, it's behavior change. And it's what the system now demands. We understand that behavior change can seem complex and overwhelming. But what we have found is that it really comes down to adopting a small set of essential practices that reshape how people participate in their care. What we teach is not vague or theoretical. It is something participants can apply directly in real-world healthcare settings. We built our training from 5 foundational habits that form the structure of what a modern health journey looks like when someone adapts to this kind of learning. Here's an example. Among the 5 foundational habits, one of the most deceptively complex is how we can get patients to better prepare for their medical appointment. This is not a surface-level task. It is a shift in mindset. We teach people how to forecast what the visit will involve so they can show up informed, focused, and ready to lead the conversation. Effective preparation starts by helping participants anticipate the flow of the appointment. They learn what kinds of questions their provider is likely to ask and what information needs to be shared. They practice outlining their top concerns and identifying what they need to know before the visit ends. This preparation gives them a structure to speak clearly and advocate for themselves in real time. In summary, this is how we do it. We walk people through this habit step by step until it becomes second nature. Instead of walking into the room unsure of what to say, they walk in with purpose and leave with clarity. This kind of preparation changes the appointment experience entirely. It creates space for clarity, it reduces guesswork, and it allows the provider to respond with more precision. The result is not just a better feeling during the visit, it is a better outcome after it. Behavior change is often misunderstood. It is not a massive undertaking. It is not a years-long program. It is a small shift that matches how modern care actually works. When people experience even one successful appointment where they feel heard and prepared, they gain confidence. They are more likely to engage again. They become partners in their care. At Patient Better, we teach these skills through a structured system. We do not rely on the patient's motivation alone. We do not lecture, we do not shame. We teach, we demonstrate, and we reinforce. Each skill builds on the next. Through the Patient Better platform, including our academy, we teach patients a structured set of skills that gives them the foundation, critical thinking, and decision-making tools they need to navigate their care with confidence and clarity. This is what it looks like when behavior change is done well. It does not require more technology. It requires more capable people. And that is what we deliver, one skill at a time, one visit at a time, one real outcome at a time. So if you're a healthcare professional looking for a practical plug-and-play solution that meets CMS engagement and documentation requirements, the Patient Better Engagement Licensing Suite is built for the demands of today's care environment. Designed for the post-pandemic, post-electronic record implementation era, our engagement suite helps you track and report real-world patient behavior, streamline participation, and satisfy the improvement activities CMS is asking for today. Watch the walkthrough video below to see how the licensing suite works and how you can start using it immediately.